Welcome everyone to the NCRO seminar on solving the mystery of hospice. My name is Chuck Austin. I'm your Master of Ceremonies today. I want to thank the Insurance Committee of the NCRO who put this together. Rich Brown is the chairman of that committee. Sherry Jelnick organized this particular seminar along with Stanley Chu and me. I want to especially thank Dale Cook, who is organizing the webinar portion, which I think is more difficult and hard to do than the whole rest of the seminar. He's done a fine job, and I appreciate his help. All of you will be on mute. There's a little red arrow on the right of your screen. If you click on that arrow and then go down to the chat arrow, you can type in questions and we'll attempt to answer those questions at the end of the seminar. So the topic again is solving the mystery of hospice. What to expect and look for when selecting hospice, learn about the services that hospice provides, when it's time for hospice, and how to look for a hospice provider. Our speaker is Barb Hendrickson. She's a former chair of Angela Hospice. She's currently president of Visible Communications in Livonia. And I'm very happy to welcome Barb to this seminar. Thank you.
Hi. Okay. So a lot of people have different reaction to the word hospice. So when we do this in person, we ask, exactly what words come to mind. And a lot of them are fear, death, the end, giving up. So everybody has their own perception of hospice, and that's why we call it solving the mystery. That some people are very familiar, other people have no idea the services that hospice provides. So there's still some mysteries to solve and some myths to dispel this morning. So thanks for your interest. Hospice does deal with end of life. And for that reason, people are reluctant to talk about it. So thank you so much for your interest in hospice today. And now I got to get back out of here. Okay. This is a quote from the foundress of Angela Hospice, Sister Mary Giovanni. So death is handled differently in different cultures. Americans seem to be the only ones for whom death is an option. So we plan for everything in life. We plan for weddings, the birth of a child, even funerals, but we don't often plan for the last phase of our lives. And this can be a very meaningful and spiritual time. So what is hospice? These are points that I hope, if you remember nothing else from today, that you take these with you. Hospice provides support, comfort, and care, not just for the patient, but for their loved ones and their caregivers. Hospice acknowledges that death is a part of living. And most importantly, hospice does not hasten death. In fact, hospice has no effect on the patient disease at all. It's the disease that's affecting the patient. And finally, although people associate hospice with death, it actually focuses on quality of life. So this is how Medicare defines the hospice benefits. So we mentioned a focus on family as well as the patient. Hospice offers a full team, including doctors, nurses, social workers, volunteers, and more. Drugs to manage pain and make the patient comfortable. Any medical equipment that you might need at home or wherever the patient lives. Volunteers are a really important part of the process. And finally, grief and bereavement support after the loved one passes away. Some hospice services also include these elements. Angela Hospice has one of only 2 care centers in the area. Palliative care, which we're going to cover in more detail in the next couple of slides. Telehospice, which is an iPad Skype concept that provides 24/7 access to a nurse. Music, massage, pet therapies, and more. Some hospices provide a pediatric team. Caregiver training, which is critical. And grief and bereavement counseling available to families and the community, whether or not you have ever had an interaction with Angela Hospice. So we talked about the team approach that hospice offers. So the physician services include your loved one's doctor, who will approve the plan of care and works with the hospice team. In a full hospice program, a medical director is available to the attending physician, the patient, hospice care team as a consultant and a resource. Registered nurses will monitor your loved one's symptoms and medication and help educate both the patient and the family about what's happening. So the nurse is also the link between the patient, your family, and the physician. The social worker counsels and advises the patient and family members and acts as their community advocate, making sure they have access to all the necessary resources. Clergy and other spiritual counselors are available to visit the loved one and provide spiritual support at home. Spiritual care is a personal process and may include helping your loved one explore what death means to him or her, resolving any unfinished business, saying goodbye to loved ones, and performing a specific religious ceremony or ritual. And although Angela Hospice is faith-based, sponsored by the Felician Sisters, they accept any faith and have multiple representatives from all kinds of religions on staff. Physical, occupational, and speech therapies. These hospice specialists can help your loved one develop new ways to perform tasks that might have become difficult because of the illness, such as walking, dressing, or feeding themselves. Home health aides provide personal care, such as bathing, shaving, and nail care. And homemakers might be available for light housekeeping and meal preparation. Caring volunteers have long been the backbone of hospice, and they're available to listen, offer the patient and family compassionate support, a break, and much more. So these are the services that the hospice team provides. So the team develops the plan of care. They manage pain and symptoms, attend to all the patient's emotional and spiritual needs, teach the family to provide care. And this is important to note, that unless you're in a care center, hospice is not full-time care. The hospice team provides a break for the caregiver and trains the caregiver and the family on how to care for the patient. Serves as an advocate for the patient and family, and finally, the bereavement care and counseling that we talked about. Hospice care is provided wherever the patient lives. So studies show that more than 80% of people would prefer to die at home, but only 20% get to. That said, hospice care, again, is provided anywhere the patient lives. It could be a long-term care facility, in their home, in a hospital, or some hospices, again, like Angela, provide a care center. When your loved one's goals have changed from treatment to comfort and quality of life, that's the time to ask their doctor about hospice care. And it's okay to reach out to hospice first if your medical team has not suggested hospice. The hospice team will come out to evaluate your loved one, and then will help facilitate that conversation with the physician. A patient qualifies for hospice care when they've been diagnosed with a life-limiting illness defined as a disease that, if it follows the expected and normal progression, will limit the patient's life to 6 months or less. So what happens if your loved one is diagnosed with a terminal illness and they live longer than 6 months? In fact, this happens frequently, since nobody can definitively predict when someone's life will end. The important point here is that there is some sort of decline if the illness follows the expected and normal progression. So most often we hear terminal or life, when we hear terminal or life-limiting illness, cancer comes to mind. Certainly cancer can be a terminal illness, however, it's not the only one. Heart failure, COPD, dementia, ALS, liver failure, renal failure are other common life-limiting illnesses. In the last couple of years at Angela Hospice, just under 37% of the patients had cancer. So more than 63% were non-cancer diagnoses. Who pays for hospice care? All of the above. So a call to the hospice can help walk you through these options. Insurance can be tricky, and sometimes it is a combination of these. It's also important to note that some insurances will pay for the hospice care, but not necessarily the hospice service. So for instance, at your home, it will pay, the insurance will typically pay for the hospice care. If you're in the care center, it may pay for the hospice care, but not the room and board. So this will be something that one call to your hospice can help you navigate these tricky insurance situations. And that's also what the social work team is there for. So there are typically 3 choices when a patient is facing an illness. So curative care is the traditional care we're all familiar with. So chemo, radiation, it focuses on quantity of life and prolonging life. Curative care can actually cause more suffering when a cure is not possible anymore and treatments and procedures are needlessly extending a period of suffering. Quality of life can be elusive if the patient is subjected to treatments and interventions that they did not choose, such as respirators, intravenous infusion, and tube feedings. And within the hospice philosophies, patients are encouraged to complete advance directives. These let your family know your preferences regarding resuscitation measures and other life-prolonging measures. So these advance directives are respected and honored by hospice. And there, for your future reference, there is a second presentation that Angela Hospice does on, it's called the 5 Wishes, and it covers these types of advance directives. Palliative care focuses on the quality of life and death and views death as a natural part of life. Palliative care is a lessening and a relief of physical and spiritual suffering so that the patient can accomplish his or her goals and life closure tasks. Those closure tasks might include saying goodbye, letting go, finding meaning and value in life and death, and mending relationships. Control and management of physical, emotional, psychosocial, and spiritual pain and suffering and other end-of-life measures are paramount. And palliative care helps to determine the specific things that bring quality of life to that particular patient. Palliative care can be given while the patient is still receiving curative care. And we're going to clarify this even further in a minute. So hospice care, the most intensive comfort care available that focuses on quality of life, is generally intended for the final months of life when a patient has the life-limiting illness we talked about, and they've decided to forego other treatments for that disease. So hospice allows the patient to make their own decisions about the way in which they want to spend the rest of their lives. We've often heard, my mom went into hospice and died within a couple of days. Because it's such a scary thing, many people wait until the absolute last minute to call hospice. and this deprives the patient and the family of all the benefits that hospice provides. It's important to understand the subtle differences between palliative care and hospice. Hospice is available to those with life-limiting illnesses with a prognosis of 6 months and the patient has discontinued curative treatment. Palliative care does not have those limitations, and it's all about pain management. So palliative care can be provided concurrently with curative care and most commonly supports patients with chronic long-term illnesses, focusing on pain and symptom management. On the other hand, palliative care does not provide the same range of services as hospice, such as the social workers, care for the family, spiritual care, bereavement services, etc. So all hospice is palliative, but all palliative isn't hospice and doesn't provide the same range of services. Many people are so afraid of hospice, but keep in mind that hospice, again, does not affect the patient. The disease does. Hospice helps to manage pain and supports and trains the family how to care for their loved one. In fact, studies find that patients who use hospice actually live longer, an average of 29 days longer than patients with similar diagnoses that don't use hospice. So why is that? It's explained by this quote from the New England Journal of Medicine. So a friend of mine, her mother was 94. She was in a great deal of pain. There was nothing else that could be done for her. She's terrified of the word hospice. Finally, talked with the doctors. She was admitted to the care center. Because she was made so comfortable with medication, her daughter said, I want to bring you a mirror right now. She said, your color is better. All your wrinkles are gone. The pain look is gone from your face. So we think that because people get in and receive care and their symptoms and pain are managed, they're able to relax. We spoke at the beginning about the main goals of hospice care: to care for the family, for people nearing the end of their life, and to help and support their family through the process and beyond. There are general guidelines for bereavement care after hospice. However, bereavement programs are not necessarily created equal. So each hospice provides support in their own way. These are the, quote, rules that every hospice must provide: 13 months of bereavement care following the death of an adult and 24 months following the death of a child. All the care is not provided equally. In some places, that might be handing you a brochure. In other cases, it can be comprehensive support groups and individual counseling. So it's important to understand the care that different hospices provide. If you've talked with anyone who's used hospice, they likely had comments similar to these. They couldn't believe the support. The hospice team, certainly they are very special people. They made a difficult time peaceful. We had no idea they offered this many services. The experience was comforting. And the number one comment we hear from just about every family. So once you have the diagnosis and the patient has decided not to pursue further treatment, that's the time to call hospice. So get that help and support sooner rather than later. I want to say a couple words about not-for-profit organizations. Not all hospices are nonprofit. For-profit organizations have owners or shareholders that income is distributed to. There's a little different orientation and focus and manner between for-profit and nonprofit organizations, and that includes hospice. So the couple of points I'm asking you to remember: hospice care does not change the diagnosis, and it does not accelerate the disease. It actually helps the patient relax and proactively manage the end of their lives. Hospice is available to anyone with a life-limiting illness. It's covered by most insurance and Medicare. And again, hospice provides care for the patient, but also for their families. So in closing, I want to return to this quote from Sister Giovanni. Hospice addresses the phase of life that nobody really wants to talk about. The goal of hospice is to support the family or the caregiver and to allow the patient to be comfortable and participate in planning for the end of their life, a time that can be just as precious and meaningful as the beginning of life. Thanks for your time. Chuck, do you want to come back for, or Dale, do you want to come back for questions? And I'm going to leave you with contact information for Angela Hospice if you needed any kind of further information. It's really common for people to not be that curious about hospice until it's time. And I can't tell you how many friends have called me, you know, they know that I've been involved with Angela, and they'll call me and say, okay, tell me about hospice. When is it time? What do I need to do? Who do we need to call? So it's great that you guys are looking at this information.
Barb, I assume that Angela also allows for volunteers.
Angela
and
has about
trains.
400 volunteers, and that is everybody from people who, they're not having any events right now. They're like everyone else, they're virtual events, but they have people volunteering everything from their patient visits to working the events or putting together mailings for the events. So it's possible to, if you feel like you want to be involved, but you don't think you want patient interaction, there's plenty of stuff to do as a volunteer. When I was on the board, I went through their volunteer training. Angela's is a very comprehensive 16-week training period, and then people who are interacting with patients actually get further training. So it's really comprehensive. I had one person in my class who said they had volunteered at a different hospice, and they literally handed them a brochure, and that was the extent of the training, and they just didn't feel equipped.
I've
Yes,
become a
volunteers are
volunteer.
critical.
I've become a volunteer for Hospice of Michigan, which is
Nice.
also a nonprofit. And they
Yes.
have a brief training session. They show you a couple of videos. They discuss how to relate to people. And of course, there are different volunteers doing different things. I visit patients
Nice.
or their spouse. And it's not just meaningful to the other people. It's been very meaningful to me. And I would urge any of the listeners who are looking for an opportunity to help people during this very difficult time that they consider becoming a volunteer. Do you have contact information if people want to volunteer for Angela?
They can start with Jennifer Kirkland, the stuff that's the information that's on the screen, but they do have a volunteer coordinator, and there is information on the Angela website, and that's angelahospice.us or .net.
As you pointed out, it's one of the most important stages in a person's life. And people are so thankful for whatever hospice does or whatever hospice volunteers do. It's a very gratifying experience for a volunteer.
Well, that is a question that I cannot answer. I have no idea what the government will change or what elements of the ACA might be changed. Right now, obviously, that may change some of the Medicare or Medicaid details. It should not change what insurance companies individually can provide. So I don't know how to answer that question.
I am involved in advocacy, and from what I can tell, looking over the laws for the past several years, hospice was approved before the Affordable Care Act. So my judgment would be that there's probably very little effect. They're separate laws, but I can't say for sure.
I do know that there's a fairly strong lobbying effort to make sure that hospice is included when they make all these, new regulations. Sometimes lawmakers are just not aware that hospice exists. And so I do know there's a pretty strong lobbying effort. No, Angela is a local organization, mostly Southeast Michigan, although they do have some reach downriver. They're primarily Livonia, Plymouth, Northville, Canton. They go out to Holly or Howell, I think. And so they are definitely a local organization, and they also on the website or a call to them would answer, if they're available in your area.
I can also say that Hospice of Michigan pretty much covers the state of Michigan. I'm a volunteer in Alpena, where our cottage is, as well as downstate. And I know they have Ann Arbor, Grand Rapids, and so on and so forth. As Barbara said, though, I think the main thing is to look for a nonprofit first. Most of the nonprofits are volunteers that are really committed to the mission of hospice. Some of the bigger ones associated with hospitals, it's just part of the services they provide.
And almost all hospices now are affiliated with some kind of hospital system. And so that's an important thing to understand, that you are not obligated to use that hospital's hospice system. You can request a different hospice. So Angela is independent. They are not associated with a particular hospital system. And so they can service anyone. There is a difference in orientation between nonprofit and for-profit, but nonprofit does tend to rely a little more on volunteers, not necessarily certainly for patient visits, but not for patient care. Obviously, those are qualified and certified doctors, nurses, and social workers, the whole team. But they do tend to, nonprofits do tend to rely more on volunteers for some of the administrative stuff, like planning their events and coordinating those events, and then the patient visits like Chuck is talking about. The question was, what is Angela a national organization? There are plenty of, and Chuck mentioned that he thinks Hospice of Michigan covers the whole state. Wherever you live, there is some sort of hospice service that will cover. So if you have, a loved one or a contact anywhere in other states or wherever, there is definitely going to be some hospice service available to them.
Well, I think we've allowed time. I'd like to thank Barb for her presentation and for the wonderful information she shared with us. A questionnaire, a survey will be sent out. So those of you who are participants, you'll be able to comment on the presentation. And if you have any questions, you can ask them at that point, and we will refer them to Barbara as well. So again, I thank you all for attending and have a great day.
Thank you
Bye.
very much.